takes an axe sometimes, a feather in the sunshine and bad weather. It's a matter of getting deeper.
Hi, I'm Jeannie Balloon. Welcome to Jeannie on the Beat, Talking with the Talent, Ann Arbor's newest talk variety show, where I'll bring you up close and personal with fabulous writers, performers, and all-around fascinating folks. My guests tonight are Brodie Burris and Carey Ryan. Brodie is the founder and owner of the Lotus Center on the far east side of Ann Arbor. He's an acupuncturist and herbalist and is president of the Michigan Association of Oriental Medicine. Carey is also an acupuncturist, practitioner of traditional Chinese medicine, and the co-director of the Center for Sacred Living, a multidisciplinary wellness center located on the far west side of Ann Arbor. So welcome, Carey and Brodie. It's great to have you.
Thank you very much,
Thanks for being
Jeannie.
on the show.
Thank you.
So Brodie, let's start with hearing about the Lotus Center. Tell us about that.
Sure. Well, again, it's a multidimensional space with a wide variety of practitioners and modalities that are available there, as well as classes that range from yoga to breath work to meditation, and all sorts of things in between.
So you have acupuncture and what else?
Massage, and cranial sacral work, rolfing, and occasional other modalities that are also mixed in there with psychotherapy and Ayurvedic medicine. And
So for people who don't know what maybe half of those things are, they're
Right.
basically for healing, right?
yes,
Alternative
it's all
types of
about
healing.
alternative medicine and
Okay.
healing modalities. Yeah.
Like rolfing? What the heck? What's
Structural
that?
integration is another name for it, but yeah,
Okay, great.
all the weird stuff.
So Brodie, can you give us a Cliff's Notes version of like Chinese medicine for dummies?
Sure. You know, it's an enormous field, so it's difficult to summarize, but essentially there's two main things we're trying to accomplish with Chinese medicine. We're trying to open up and invigorate the circulation of the energy and the blood flow throughout the body. The energy is known as qi, and on a chart here, this shows us some of the major pathways or meridians in which the qi is said to flow through the body. And then the other half of the medicine is the internal medicine component, in which case we're interested in the relative balance of energy in each of the individual organ systems and their relationships to each other. And so in total, with health essentially in Chinese medicine is the free-flowing movement of qi in blood throughout the body and the balance and harmony of the energies in the internal organs. And that is, achieving that is the goal of Chinese medicine, acupuncture,
and when you
and
have
herbs.
that, then you're healthy.
If you've got that, then you're definitely healthy. And any signs, any disruptions to those lead to various sorts of symptoms that emerge. And so, based on your symptoms, and also some objective evaluations, or I guess my subjective opinions of the quality of your pulses, the look at your tongue, your skin, your eyes, your hair, basically taking you in, we will actually form an opinion about what we think is going on, what sort of imbalances may be present that give rise to your discomforts, and then to treat you accordingly to balance that out as best we're able. Is it chemical? Is it electromagnetic? Is it functional with the connective tissue? The problem is it's all of them together.
So what is it about sticking a needle in you that makes you feel better?
You know, it's
You know, I
still
know
a
that-
mystery, really. I hate to say that. It's an unsatisfying answer, I know.
Is,
The way
it
we
like
think
helps
about it
move
is
the
it's-
energy?
Yes.
Somehow
the way traditionally,
it helps move the energy.
Exactly.
Okay.
Traditionally, we're thinking in terms of we're affecting the energy of the body. And so we're either sedating, which is sort of releasing excess energy, or we're tonifying, or strengthening and putting in energy, or we're just invigorating the energy.
So
if it's-
working with the energy, so the needles somehow impact the
Yes.
quality or the quantity or the levels of the energy.
Yes. I mean, it's
Okay.
an energetic medicine, and if we wanted to get more esoteric about it, I mean, really in the space of the amount of time I have to describe it, it's difficult to
Yeah.
do it justice. But, you know, our intentions as practitioners are sort of focused, if you will, and augmented by the needle. It allows us to sort of access and stimulate your body, creating a sort of, I guess you could say, resonant field of effect on your system. So each of the needles I put in sort of is a little splash on the body, a little ripple. And I set up a variety of needles that all sort of work together to shift things.
In a specific pattern that's intended to impact a certain part of the
yeah.
body.
And we're really just encouraging the natural processes which are already, trying to happen. The body wants to heal constantly. And so we're just facilitating that process, if you will.
Okay, that's interesting.
Okay.
So why would somebody choose acupuncture over traditional Western medicine? What are the benefits?
Well, I suppose one of the benefits of choosing it over, and I don't want to put it out as acupuncturists in general believe that people should necessarily choose it over Western medicine. We're not trying to compete as something instead of, but really we would like to be recognized as integrating as a piece of the field of medicine out there. So it's one of the tools that people can avail themselves of. It's not like the best or the only, but it does have some advantages in many ways over Western medicine, as Western medicine has some advantages over Chinese medicine, of course, as well. But one of the greatest strengths of acupuncture is certainly its safety. It is really one of the safest medical modalities that exists on the planet. Nobody dies from getting acupuncture.
Nobody's ever died?
Not that I know of.
So there's no documented case
That I've ever heard of. Nobody's ever died from getting acupuncture.
And you've been doing this a long time.
I'm in my 13th year of practice.
13th year of practice,
And in fact, I've never heard of anybody getting really more sick or seriously injured. In the course of the 13 years of my practice, I put in probably 250,000 needles in people.
Wow, 250,000 needles?
Yeah.
Wow.
And
okay.
in that time, the worst side effect that I've experienced, that I've created, would be, I guess what we'd have to acknowledge is like some nerve damage where I hit a nerve twice. Out of the
And
250,000 needles, I've hit 2. And the result was that the spot was sore for a few weeks afterwards, and then it resolved.
But the hand didn't fall off.
It was sore in the spot where I needled it for like 2 weeks, and it went away. And that's the worst thing I've done to anybody.
And they still hold you.
And so, I mean, it's very difficult to really hurt people. I mean, you can't. You'd have to be severely negligent. There are cases where people do something where they can hurt somebody. Like occasionally, a pneumothorax is like the worst thing I've ever heard of happening. I don't know anybody who's ever done it, but I've heard that it's happened in the field of medicine, and you really have to practically try to do something like that.
But still, relatively speaking, it's like minuscule little drop
in
the
relative
bucket.
comparison to the risks that people undergo in a surgical procedure or taking, cocktails of medications. It's almost negligible.
Or even compared to aspirin,
Well, it's safer
just,
than aspirin.
Yeah, well, if you read the side effects possible with aspirin, I always think that's kind of fascinating,
Yeah.
You would be amazed if you read them. I mean,
safer than aspirin. I love that. That's a great
is
great
good.
line when you have advertising.
It's true.
Acupuncture, safer than
I mean,
aspirin.
if you read the side effects, you would be.
Yes, and I don't want to tout just the safety as like the primary reason why acupuncture you might choose over Western medicine.
It must work.
It's also
People
very
wouldn't
effective.
Been doing it for thousands of years, right?
Exactly. When I was in graduate school, I had a moment of panic. Like, what am I doing with my life? I'm going to stick needles in people for a living. Are you kidding? And then I thought, literally hundreds of thousands of people have spent thousands of years practicing this art and medicine and science on millions of patients, and they continue to do it. Something that's ineffective couldn't withstand that level of scrutiny, in my opinion. We eventually, and it's not like people weren't paying attention, they're scrutinizing carefully the effects that were occurring. So this is one of the most closely examined and well-vetted medicines, I believe, that exists on the planet. I mean,
Wow.
when we
That's
talk
saying
about,
something.
you put out a medicine on the market these days, and 5 years later they pull it because it's killing people. That's like 5 years, 10 years of efficacy in the public.
Right.
We can see how medicine works and how safe it is. This has been the primary medical modality through most of Asia for the last at least 3,000 years.
That's saying something.
So
All right, great.
the
Yeah.
efficacy and safety are pretty well established.
Well, you got me convinced on that point. Okay?
There we go.
So next question
Sure.
is, of course, I'm sure you get this every day. Is it going to hurt? Because, needles, who wants to get poked with a needle?
True. Well, I can't say it's without sensation, but the needles I'm using are like fat hairs. They would fit the hole.
Fat hairs?
Yes, you'd have a hard time seeing them. Yeah. They're 0.2 of a millimeter in diameter. To give you an
Wow.
example, it's like we use
So
30.
they're so small that you
Yeah.
can barely feel them.
Yeah.
Okay.
Well, typically you can barely feel them. There's two possible sensations, or I guess three, we could say. If I catch a sensory nerve at the surface, which frankly can happen, it's rare, but occasionally will get you, it's pinchy and stingy. But we can fix that immediately. Most of the time, you barely feel much of anything. Maybe a little mosquito bite, and then that's it. And then sometimes you feel a strange sensation of some achiness, or tingly, or warmth, or swelling, or other strange feelings. We characterize that as the experience of qi,
The energy.
of the energy that you're feeling
Moving.
now
Okay.
as the needle affects the energy. And so that can be an experience that people will have. But very, very few of my patients, I think, would describe their experience as painful, without question. We want it to be a very pleasant, comfortable, relaxing experience.
All right. So I'm willing to be a guinea pig here. So Brodie, I know you
All
brought
right.
some needles.
Yeah.
So why don't you come on over here and show me what it's like.
I'm happy to do
Give
so.
me I'm going to lend you my hand here.
All right, excellent.
So that
I'll
our
happily take
people
it.
at home can see it. So these are the needles.
Yes. So they come in a variety of packages, but they are all pre-sterilized, disposable, single-use needles.
Okay.
I don't know anybody who doesn't use that form of needle. They're very cheap, and there's no reason why you would see a practitioner that doesn't use that. So I still get people asking me if I'm
Used
reusing
or-
needles, and
yeah.
there's absolutely
Just no.
no. There's no reason for doing that. No one would ever.
Just no.
No one would ever do that. It's
Okay.
completely absurd, actually. But
Yeah.
anyways, I understand. People need to ask, and
Okay.
I'm not upset by it if they do. So,
Okay.
anyways, so I just want to demonstrate sort of the experience. We've got our tiny little needle here. We're finding our space. I've got a little guide tube, which helps me keep the needle in the correct spot, and then I just sort of set it in place.
I didn't even feel that. I just felt you tapping.
Right.
But I didn't feel the needle going.
That's the goal.
That's awesome. I've never seen that before with the little guide tube and everything. I didn't
Yeah.
know that's what you were doing.
Well, some people freehand the needle, which means they just will put it in without a guide tube, and that's a style that some people use. But I've found over the years that, frankly, it's the most comfortable style, at least in my skill level, to get it in painlessly using the guide tube. And since
Alright.
all the classic texts really only talk about what to do with the needle once it's in, none of them mention really exactly how you get it
How
in.
do
Yeah, I don't get. Then that doesn't seem
Oh,
to be
darn.
the important part. It's sort of just get it in, and then now what are you going to do with it,
Well,
right?
as Americans, we're pretty wimpy and
Right. No one wants to have an unpleasant experience, and
Yeah.
we don't want you to have an unpleasant experience either.
that's a pretty cool little technique though.
So that's all
I'm
it is.
feeling like a pulsing
Yeah.
going through my finger, my index
Uh-huh.
finger.
Well, the meridian that we're treating here runs right through that area and right up your arm.
Okay, so you didn't just stick it in, you knew where you were putting it.
Oh yeah, I picked that's the acu part of the puncture, right?
Get it accurate. It stands for accurate, right?
Yeah, exactly. So I'm putting it, right where I want it to
So
go.
where'd you put it? Why'd you
This
put
is
it there?
Well, frankly, I put it there because it's an easy point to
Access.
get to, and
Okay.
it's easy for people to see it, what's happening there.
Mm-hmm.
It's a point called hegu in Chinese, or large intestine 4 is sort of one of the other names people will use. And it's a very powerful point, very commonly used point. that has a wide variety of effects, invigorating the energy throughout the body,
Awesome.
opens up the face.
Feeling more invigorated by the moment.
Are you? I'm
Thank
sure.
you so much, Brodie.
My pleasure. Would you like me to?
Yeah,
remove
yeah.
that?
Why
I
don't you
imagine
go
you
ahead
would.
and take it out?
So we just pluck it out.
That's
You
it.
see, there's no hole, there's no blood, there's
No hole, no blood squirting.
no.
Hey, very
No problem.
uneventful, really.
Yeah.
Just a little.
Yeah, and we try not
surprised.
to. We try to use as few needles as possible as we treat.
All right.
Typically, so you can expect in a treatment to get anywhere from maybe 10 to 20 on your average treatment.
10 to 20.
10 to
Okay.
20, somewhere in there. There's a lot of misconceptions that you're going to get covered with needles, and that's never
head
the
to foot.
case. No, it's good for the camera, on photos and
And the movies.
and in the movies. But
That's not
in
right.
reality, it's you might
Okay.
have 2 or 3 in each arm, 2 or 3 in each leg. Done.
Okay, cool. That's great. So, Carey, you run a center on the far west side of Ann Arbor called the Center for Sacred Living.
Yes.
Can you tell us a little about that place and what you're
Sure.
doing over there?
Yes, I'd love to. So I'll give you a tiny bit of history, which is that it was founded in, I think, 2000 by Abby Humphrey and Becky Hackenberg, who are two really fantastic women. And they wanted to create a space that was really nurturing for practitioners to blossom as well as the clients. So, and over the years, Becky and Abby have both moved out of town. So Tiffany Mazurek and Rob Colliner and I have stepped in, and we've taken over the center, and we moved locations and expanded.
So you're now out on Jackson Road, right?
Yes.
Off of Parkland
yes.
Plaza.
Near
Okay.
on Little Lake Drive.
Okay.
And so we expanded the center, and we have a lovely, lovely group of people working together and sharing the space. So it's a very sort of economical use of space. So some people work 3 days, and we alternate days and share the rooms.
Okay.
So maybe I'll tell you a little bit about the different practitioners that we have.
Or the different services.
Okay, so
yeah,
Abby and
that'd be
I do acupuncture.
great. So acupuncture, just like Brodie.
Yep, and
uh-huh.
then we have 2 chiropractors.
Okay.
And we have craniosacral therapy, several really wonderful massage therapists. We have somebody teaching like clairvoyant development.
Wow.
And then we have a few people that are energy workers that it's sort of hard to explain what they do, but
Okay.
they're totally amazing people. And yeah, actually, and we also have somebody that has studied Ayurvedic medicine quite extensively who's practicing, and she's really neat. So we have a nice crew. I mean, it's really very sweet situation.
So it's sort of like one-stop shopping for your health needs, like Myers Thrifty Acres, but really small.
I mean, well, what's really nice for us is that we all it's sort of synergistic, that we all sort of have neat practices, and we all are excited about what each other are doing and think that each other are really wonderful. So it's
The love fest
yeah, it's a
kind
love
of-
fest basically, and so it's a nice energetic situation.
Okay,
Yeah.
all right, that's great. So tell us a little bit about how widespread is the use of acupuncture in China and then compared to the U.S.?
Well, I have to say that how I've understood this is from my Chinese teachers in acupuncture school. So what they told me is that there are Chinese TCM hospitals as well as Western hospitals.
TCM.
So traditional Chinese medicine hospitals.
Okay.
So in China, the traditional Chinese medicine doctors are full physicians, and they sometimes are dual trained, so that they are Western trained and trained in medicine using herbal medicine and acupuncture. And so that means that I had one of the teachers say that in the traditional Chinese medicine hospital, she was treating a patient who was in a coma, and she was able to diagnose him by looking at his tongue, and then they did an intravenous formula, and then the patient woke up,
Intravenous.
which is like an herbal formula.
Herbal.
Yes.
Okay, so they're using herbs
Yes.
intravenously
In the hospitals.
Oh,
I mean, it's pretty
herbal
integrated.
IV drip. Interesting. Okay, so
So that's just an example that they
Huh.
take it's like a really serious form of medicine there. The people are very highly educated, and it's just a part of the medical system. I think one thing that I also that I understand is that in the 50s, and I think Mao had the researchers explore the efficacy of traditional Chinese medicine, and they found it to be so effective and so cost effective that they decided to keep it instead of sort of moving only to a Western medical model,
So
which is kind of
they
interesting.
really stepped back and evaluated it to determine,
Yes.
should we be following the West and
Yeah.
abandon our thousands of years of
Well, they
practice here?
tried to.
Yeah, they wanted to, I think, but then they found it to be so cost effective.
They couldn't deny
Right.
the benefits. Interesting.
Because the technological and pharmaceutical-based medicine is so expensive, it's,
That's a very interesting history.
I thought so too.
Thank you. So speaking of hospitals, Carey, you have a private practice as an acupuncturist, but you're also on staff as an acupuncturist. Did you hear that? On staff at
Yeah.
Beaumont Hospital in Royal Oak. That is so amazing. Can you tell us about that? How did that come to be?
Well, I think it's absolutely amazing as well.
Yeah.
And what happened was, well, first of all, I'll say that Beaumont has a pretty huge integrative medicine department, relatively
Really?
speaking. The director, Gail Evo, has organized it over the years. It's kind of been growing. They have almost 30 massage therapists, cranial sacral. They have
Way.
3 naturopaths on staff.
Really?
And then they have a medical supervisor who supervises the medical acupuncture department. So there's 6 traditional Chinese medicine acupuncturists on staff under her.
6. Wow.
Which is really exciting.
Yeah.
And the way that I wound up working there is that I met somebody that was on staff there, and she introduced me to Brenda Donaldson, who is the physician acupuncturist who supervises the acupuncture department, who's a really wonderful acupuncturist and very lovely person. And so that has been a wonderful experience. It's been really great.
So what kind of responses have you had from the nurses and doctors and traditional Western practitioners to this, different kind of approach?
Well, something that's also really fascinating is that Beaumont has introduced acupuncture and massage as a benefit to its employees. So they have a certain amount of visits that they're allowed to come in, and mostly it's pain conditions, but actually I think they're going to expand it to include more functional disorders like irritable bowel or different things that are difficult to treat from the
So do you
perspective
have
of Western
doctors
medicine.
and nurses and staff coming in to you for treatment?
Which is really wonderful.
Oh, that's
And
great.
so, and generally they're having, sometimes they're a little nervous, because they're not, a lot of the people haven't had acupuncture before.
No, it's really cool.
And they look a little nervous when they come in, and we do a nice treatment, and then the next time they come in, I just see that they're happy to see me, you know what I mean? Because a lot of times they see a lot of improvement. For things that sometimes are difficult to treat from a Western perspective, like back pain, for example, is
Even
really,
just stress.
and stress, yes.
Sorry to throw that in.
You know,
but
that's
yeah.
okay, yeah, for sure. Well, actually, what's really sweet is that I treat a lot of nurses, and of course, it's so sweet to be supporting these people that are doing such important work, and they have to lift people, and they have a lot of shoulder tension and back tension and stuff. And acupuncture is really wonderful for alleviating that. So, so that's been going
Interesting.
really well. And then the other thing that's really sweet is that Beaumont is sort of a whole network of people that all know each other, and the patients see the doctors all within the same system. So just last week, Dr. Donaldson received this phone call from another doctor who said, I've been hearing from all the patients, they're just doing so great with the acupuncture. So it's sort of getting around, which is really nice.
Good. Word is getting around
It's
in a
getting
good
around.
way.
That's right.
All right. That's great. So what drew you to acupuncture of all things?
Well, to be honest, when I had my first acupuncture treatment when I was 18, I really felt like this would be I think this would be a nice fit for me. And then, to be honest, when I was in my early 20s, I had a little bit of a health challenge that was also an amazing opportunity for transformation and learning.
So you experienced it yourself first
Yes.
as a patient.
Yes.
And that
Opened my
convinced
eyes,
you.
for sure.
All right, that's
Yeah.
fascinating. So, to both of you, how do you envision the role of acupuncture in the future? I'd like to hear from what you both think about that.
Go ahead.
Okay, so what I think is that ironically, modern technology has caught up so much, and it's gotten so much more subtle in what it can detect, that, for example, you can do a classical point on the foot, for example, that classically is indicated to treat the vision center, that it would improve sight classically. And so now they have functional MRIs, for example, where you can put a needle in that point, and you can image the brain, and then the vision center has been shown to
Is
light
activated,
up, for
yeah.
example. Okay.
Awesome.
Also, they're, with being able to test the biochemistry of the body, and that you can test sometimes certain points increase serotonin levels or they decrease cortisol levels, what have you. That I feel that it's very exciting in the sense that I feel like Western medicine and the tools and technology of science are able to better observe the effects. And so it's necessary for there to be a common bridge, I think, of understanding. And sometimes that's just semantics, like the language that you use. For example, sometimes when I'm explaining acupuncture, I'll say, on the simplest level, the needles help to decrease stress response. And the effects of decreasing this physiological stress response in the body are so profound. And also in Western medicine, they're coming to understand more and more how the physiology of stress can be a major root of disease. And so I feel like as the understanding of the West is growing and that people are getting more used to acupuncture here and how beneficial it is, and I think people are also sort of wanting to find ways to really be well, which is really, it's sort of like a grassroots movement.
Future.
It's the future. Yeah.
Anything you want to add to that, Brodie?
Oh, I think that's very much the case. I think that more and more as it's accepted and understood clearer and clearer, which is absolutely the direction things are going, we'll see energy medicine, acupuncture, I would say probably at perhaps the forefront of that, being more and more integrated and accepted as a standard part of what people think of as their health care.
Maybe kind of like what's already happening in China, where Western medicine is becoming more integrated into their health system.
Absolutely, the two
Same thing
work
will
in
happen
tandem.
here in
Yeah.
tandem. So we really are a global community. We are one. That's
Yeah.
so cool. Awesome. And so do you anticipate that you're going to be more integrated into the hospital setting? Like, is insurance someday going to cover acupuncture?
Actually, I'm coming from California.
Yeah.
And if
That's
I were
that's
still in
another planet,
California,
really.
practically, but it's a model that is influencing the rest of the country. Michigan is only one of a handful of states left that doesn't have licensure, that doesn't have insurance reimbursement. Actually,
Really?
most of the rest of the country does.
No way.
If I were in California, I'd be a primary care physician. 99% of your insurance companies would cover acupuncture, herbs, the works.
That is amazing. I had no idea.
You know, I just want to put in there too that actually a lot of doctors refer to us. So I mean, a lot of patients
All the time.
So
Really?
most of the patients are referred by their physicians, to be honest. So
No
it's not like
kidding.
it's very. I think the physicians very much understand that it's very beneficial to the patients, and I think that some of the primary care physicians know that things that are not being treated by drugs and surgery, sometimes like doing alternative medicine, can be very helpful.
You might give it a shot because, again, like we were saying before,
What have you got
it's
to
safe.
lose? Yeah.
You know, I can refer people to give this a try if what they're trying, if the meds or other procedures aren't availing them. Give it a shot. It's not going to hurt you.
Yeah.
So, yeah.
Just a little poke.
Yeah.
Well, thank you so much. I know we have just scratched the surface. There's so much more to talk about, but I want to thank you for coming in tonight. I really appreciate it.
Absolutely, my
Thank
pleasure.
you so much,
All
Jeannie. It's a
right.
pleasure.
And thank you, Ann Arbor, for joining us. Remember to tune in the second and fourth Tuesday of each month at 10:30 p.m. or look for rebroadcasts of Jeannie on the Beat at various times throughout the week. Ciao, Ann Arbor.